SARS-CoV-2 is a novel coronavirus that is responsible for the COVID-19 infection.
I know that you were involved in the various groups that helped to develop this set of vaccines. Tell us a little bit about the process for the creation of the vaccines. How is it that we were able to develop vaccines as quickly and vaccines that are as effective as they are? Because historically, it's been taken a lot longer to develop vaccines for a disease that is this severe. What was it about the process that allowed us to do that? Is it technological? Does it have to do with new methods, new systems, and how was your office involved in that process?
Okay, so that's really a critical question that I believe the general public doesn't fully appreciate. So the virus was identified and sequenced and made known to the public in the first week in January of 2020. And 11 months later, we had vaccine going in people's arms. That is totally unprecedented. And usually, as you say correctly, years before you get a successful vaccine. What is hidden behind that is that for decades prior to that, the investment in biomedical research in developing new platform technologies, the mRNA techniques that we worked on for years before SARS-CoV-2, the using structure-based vaccine design that had been going on for HIV, the spike protein, which is that part of the virus that binds to the receptor. If you get it in the right conformation and you freeze it there by making mutations, it's enormously more immunogenic than the regular protein. You recall when you visited the Vaccine Research Center with me here on the campus, it's the same investigators that I introduced you to were the ones who were working on HIV, who switched over, used their technology to develop the immunogen for COVID-19, and then all of a sudden everything took off. So when you say it was quick, well, it started back when you were in the White House. Yeah. So and even before then.
After 2 decades, you were an overnight success.
Yeah, but, exactly.
But I think just to convert this into layperson's terms, essentially, rather than going through a trial and error process where you see the disease for the first time, you're trying to figure out what does it do, how does it work, what kinds of immunizations might work against it. Here you already had a bunch of structures in place that allowed you to both pinpoint what exactly the disease was doing and also figure out with much greater precision, much more quickly, a kind of vaccine that would be effective and tailored to this particular disease. Is that accurate?
That's perfectly accurate, Mr. President, but there's also another thing. The extraordinary investment that was made in Operation Warp Speed to essentially get 6 companies involved, essentially bankroll a lot of what they did, pre-purchase doses so that you could get them produced before we even knew the vaccine worked, allowed us to, once we hit the ground, boom, it was there.
Historically, there have been concerns that when you get to clinical trials, meaning when you actually test vaccines on live humans, that is a long process to make sure that both that it's safe and that it's effective. And there have been some concerns about were these vaccines adequately tested? Did we go through the normal process that we went through to figure out whether a vaccine should be widely distributed? And an issue that I think is on the minds of people more recently, was there a broad enough cross-section of people, including people of color, women as well as men, old as well as young, so that you had some sense of whether the vaccines were effective across the population equally for various people, whether there might be side effects for some people and not others. Tell us about that process, basically to test it out before we put it out there.
Yeah, it was extraordinarily well tested. Let me give you the numbers. In the Moderna product, we tested it on 30,000 people. In the Pfizer, 44,000 people. And on the J&J, 40,000 people. Things went so quickly is that we had so much infection in the community at the time that we tested it, that remember when we were doing the Zika, when we started testing it, all of the infections went down, and you go for years before you can prove it works. Here, it was like 3 months, and we were there because so many people got infected in the placebo group compared to the vaccine group that we knew it worked. That's the first thing. The secondly, we really went out of our way to get an equitable demographic representation. And it wasn't easy. We had to go out and really get leaders in the community to get people who they trusted to say, go get vaccinated. So for example, when we started off, the relative number of African Americans was relatively low, but by pushing it, we got it up to about 10%. A little bit less, because 13% is the demographic representation of African Americans. We did better with Hispanics. Hispanics are about 18% of the population. We got up to 20% Hispanics in the thing. So if you put them together, about 30+% were minority populations. So that was really a critical point that you made, because now we could tell everyone that the vaccine was tested, it works, is safe and effective in all of these groups. So that's a really important point.
I had the chance to study and read about the results of these clinical trials. It was remarkable to see how effective the vaccines were across populations. And as a result, I felt very comfortable making sure Michelle got the vaccine, making sure Michelle's mom, who is older, obviously, got the vaccine because she's more vulnerable, and encouraging everybody in my family and my friends and people in my circle and staff to get the vaccine. And yet we've still seen people who are concerned about the vaccine. And I think it's important to note that some of that hesitance has to do with people understandably always wondering, do I want to put something in my body that wasn't there before? How safe is it? What I've tried to emphasize is that we now have millions of doses that have been administered, and the fact that we've seen almost no adverse consequences is actually pretty remarkable. When you look at history, early on, the polio vaccine obviously was an extraordinary human achievement. But at the beginning, there were adverse effects for a small but significant portion of the population that ended up really being harmed as a result of the vaccine. In this case, we now have a pretty extraordinary body of evidence that these vaccines work, and they are safe, for just about every conceivable combination of people that you might want.
All demographic and all ages, right?
Every demographic and all ages. So what have you found to be some of the most common concerns, and what are the most effective responses to the concerns that people have raised about going ahead and getting the vaccine?
Well, I think it relates a lot to what you said of people have more of a wait and see attitude, and they want to make sure that enough people have gotten vaccinated that they feel that they are observing now, and as you said, it's extraordinarily safe. We now have over 140 million people have received at least one dose. So you get out and you explain to people what are the areas that you're concerned? Are you concerned whether they're safe? You give them the data that's safe. Are you concerned that it works? The interesting thing, in the real world, following the trial, it works even better than in the trial, because usually when you're in the pristine conditions of a trial, things seem to do better until you get out in the real world. When you get out in the real world, it's even better. The thing that we have found right now, which is looking like it's becoming quite successful, is the outreach by using trusted messengers. So we have a thing called the COVID-19 Community Core, where we've employed sports figures, celebrities, really important, Mr. President, clergy, particularly among the African-American population. They really trust their clergy. So what we've done is that we've reached out to these individuals, given them a lot of information so that they can then go out. Like, I have been on more discussions with people like Jesse Jackson, with people like Al Sharpton, and over again we're doing that. And it has an effect because the hesitancy among African Americans has dramatically diminished over the last 4 months. You know, so it depends on what the group is. You've got to address it. You've got to give them the information and trust that they're smart enough to make the decision themselves.
Well, look, within the African American community, there is a reason why there is probably greater suspicion with respect to the medical establishment. Oftentimes you'll hear, cited past failures of the medical community to address African American specific diseases and issues. I think that the thing that I've tried to emphasize is that in a situation in which African Americans are more vulnerable to this disease because of underlying conditions like diabetes or obesity that are high blood pressure that are higher than the general population, it is that much more imperative for us to take advantage of a vaccine that is much more effective than the flu vaccines, that
by far
much more effective
right.
than the flu vaccines that we take periodically. And by the way, my personal experience, I know people have wondered about side effects. So I got the Pfizer vaccine, and like a lot of people, I had some flu-like symptoms. Wasn't feeling that good. And that meant that the vaccine was working, because essentially the way a vaccine works, it is triggering a response in your body, helping your body recognize, this is something that can make you sick. This is something that you have to worry about. So it's almost a trial run in terms of getting your body prepared to fight off this virus. And, I was laid up in bed on the couch for about 6-8 hours. I took a Motrin, and after that I felt fine. And it was a pretty good excuse for me just to sit around and loaf around, which I don't always get a chance to do. Young people, I think, have been a little more hesitant, in part because they felt invincible. And their attitude is, look, if I get it, it's not going to be that serious. It's not like grandma in the nursing home, where I understand why she would need to get a shot. But if I get it, it's just like a bad cold, and I'll get it for a couple of days, and then I'll have some antibodies in there, and I'll be all set. One of the things that you may want to address that we've all been observing is that these viruses, like COVID-19, mutate. And we've seen variations, the so-called British mutation, Brazil, South Africa, variations of this basic disease that are more easily transmitted, more lethal, and appear to have a more severe impact potentially on young people. So talk to me a little bit about why it's important that this is not simply a matter of either an old person's disease or a bad flu that they'll get over without any side effects.
Okay, so there's two issues there that we need to address. The first is what you've touched upon. Even though statistically, to be honest and transparent, the chances of a young, healthy person in their 20s or 30s who are otherwise healthy of getting infected and getting significantly ill is very, very low, extremely low, compared to the elderly or those with underlying conditions.
Right.
However, I myself have seen patients that we've taken care of in the NIH Clinical Center who are young, who had an underlying condition like hypertension or diabetes or obesity, who felt, hey, I'm young, I'm okay. They got seriously ill. So you're not completely out of danger. Don't fool yourself. That's the first thing. The second point that you made is also quite true, is that some of the variants that are going around now are more transmissible, more lethal, and they're infecting younger people. But the other important point that I think is equally as important is, even though, let's say, a young person gets infected and has absolutely no symptoms, they say, so what's the big deal? You know, autopsy, no foul, no autopsy. You know the way we used to say in basketball. But that's not the case, because even though you feel fine, you are being part of the transmission cycle. So you can be infected and then inadvertently and even innocently infect someone's mother who has breast cancer on chemotherapy, or someone's friend who's obese and gets into trouble. So just because you don't get infected, that doesn't mean you're not part of the problem, because you're propagating the outbreak. So I appeal to, and I hope I get to people, that one, you have your own personal responsibility to protect yourself, but you really have a societal responsibility to the community, because you don't want to be part of the problem, you want to be part of the solution. And that's what young people need to hear, that it isn't okay, no symptoms, no problem. It's more than that.
Right. For a lot of folks, if they don't have a regular primary care physician, maybe they're part of a population that doesn't have access to a computer to sign up. It's confusing sometimes to figure out, all right, how easy is it for me to get a vaccine? I know you've been working with the administration on this issue. A lot of it has to do with logistics. Can we confidently say at this point that if someone wants to get a vaccine, they can get it, and that we're reaching out to communities, even those that are not wired and plugged in and as sophisticated in terms of accessing medical care as others?
President Biden has made it a major priority of his for equity. We've established an equity task force. We have people in the White House who only think about equity, and he's done 3 or 4 things to get accessibility to particularly underserved populations. One, he's put community vaccine centers in areas that are demographically representative of minorities. Number 2, we have federally qualified health centers that we now have in those areas. In those areas that generally are not particularly accessible, and we have mobile units going out into those rural areas, particularly in the South, where you don't have accessibility. And then what we've done, we've mobilized vaccinators, people, retired physicians and nurses, the military, to go out and do it. So we are trying very hard. We're making equity a major part of the vaccine program.
Just to sum up, these vaccines are extraordinarily safe. They are proven. It is important for all of us to get a vaccine, because just because half of us get it, that doesn't wipe out this disease. We need to get the vast majority of people to get it, and it's available. So we need everybody to go out there, get informed, do your homework. If you have some hesitancy or concerns, those questions can be answered. But if we want to get back to the point where all of us can enjoy each other's company and go to concerts and restaurants, and most importantly, hug our family and spend time with them safely, whether you are young or old, now's the time for you to get that vaccine. Is that a fair summary?
Couldn't have said it better. Perfect. Absolutely.
It's wonderful to be with you again, Dr. Fauci. Thanks for the extraordinary work you've been doing.
Thank you very much, Mr. President. It's my honor today. I've been with you. Good to see you again.
Good to see you. Bye-bye.
Bye-bye.
Thereby blocking their entry into the healthy cell and thus creating immunity.